In today's video, we're gonna talk about the healthcare system. We're gonna share our experiences in the UK with the NHS, in Romania, and also what we experienced here in Greece. We're gonna share our opinions, we're gonna do some comparisons between these healthcare systems.
Yeah.
So yeah, let's get into the story.
So this is Raw, Unedited, Unfiltered, Uncut series. Basically the series where we take you with us and we talk about a topic, but we're not gonna edit anything. What you see is what you get. We're not gonna cut anything if we mistake something or if we do whatever we do. This is what it is.
Yeah, I think this is just to make things feel more natural.
Yeah, this is a real way to see us and like having a conversation.
Yeah, so we are in Crete and we don't take this walk that often. We've been here once, but it's really beautiful, so we wanted to share it with you.
Yeah, just look at this. Look at this beauty. Look at that city, whatever it is. I think it's Platanias.
Yeah.
How nice it looks, everything. Just near the sea.
It's really, really beautiful.
Yeah, so healthcare, Romania, UK and Greece. But before we get into the story, please press that like button. It really helps us, guys. It really helps us.
It only takes 2 seconds. We can take 2 seconds and wait for you to click on that like button. So just make the screen small, go press the like. We're gonna wait. You're not missing anything. Come back here, make the screen large again.
Okay.
And we can continue the story.
Okay, now let's get into the story.
Yeah, so I think it's important to say at the beginning that usually people don't have a great opinion about healthcare system in general, wherever they live. Because we asked a lot of people in the UK, in Romania, wherever
Nobody's
we
happy
went.
with their healthcare system in their home country. Or
Everybody has complaints, or some bad experiences.
When we lived in Romania, we were not happy with the Romania. Nobody in Romania is happy with the CAS, I think it's called, with the healthcare system. In UK, they are not happy. They say the system is shit, even though it's not shit.
I think you are happy with your healthcare system when you experience something worse.
I think you're healthy with your healthcare system when you're healthy.
Yeah, it's true. Yeah, so with that being said, we understand and we feel you. Everywhere is hard, everywhere is complicated, and it can be a great experience or it can be the worst experience of your life. So we totally get that. We experienced good and bad things everywhere. Yeah.
But yeah, emergency healthcare, it's free. It's free in Romania, it's free in UK, it's free in Greece. So if something happens to you and you need emergency,
it doesn't matter where you're coming
help,
from, you will get some help.
You will get help in all these countries. It's not like in America that you will have to pay afterwards.
Yeah.
It's not like that. Then you will pay this healthcare system for normal healthcare from your income in each of these countries.
Yeah.
In Romania, in Greece, and in UK as well.
Basically, they say healthcare is for free, which it is. You can have access to it. But the truth is you pay for it through your income, through your taxes. So yeah, it's a free healthcare system as long as you work in that country.
Yeah. Then the state of hospitals. In Romania, I would say the hospitals are a bit outdated. They try
more, yeah. The free ones. We're talking now about the free healthcare system, because everywhere in these countries you get the private clinics, you get the private hospitals, which are a completely different thing. So the free ones from the state, they're outdated, in a rough condition. Most of the time they don't have their essentials, they don't have,
Yeah, they try to renovate it and they're doing a great job. But
it takes time.
They're still outdated. Outdated compared to who? Outdated compared to UK. Because in UK, they look very good.
Yeah.
They look spotless, well organized.
Yeah, I would say even the cleanliness, it's a bit better from what we
Modern one, yeah. And in Greece, I think, falls something in between, more towards the Romania, more towards the
Yeah, a bit more outdated because they went through the same things as we went. So yeah, we understand the situation and why it's like that.
But they look a bit better.
Yeah.
So for you to understand our perspective, we come from Romania, from a well-developed city, which is Cluj. It's the second one in Romania, I would say. I would say the first one, but you can argue with me there. Then we went to UK in a new city. New city is 60 years old city, is the newest one in UK. Very nice one. And here we live in Crete, and we've been to two hospitals.
Yeah, in Hania and Iraklion, the only two hospitals on the island.
Yeah.
So we are sharing our experiences through this perspective.
Then the quality of doctors. What would you say there, Amalia?
So I would say there are great doctors everywhere, and there are also less experienced doctors. So it depends on your experience. You can have the best experience of your life or the worst one everywhere. But I think in general, in Romania, I would say we have pretty good doctors, and they are very well prepared. The way, the school goes in Romania and everything, they're well prepared. And I think this is very similar to Greece as well, from what you told us in the comments and what we heard from people. The doctors are very, very well prepared. In the UK though, because it's such a large number of people working in the NHS, and also even more people needing it, and they are understaffed, things look a bit different. The system is a bit different. There are excellent doctors. Some of the best hospitals in the world are in the UK. But at the same time, you don't necessarily get to those hospitals. So you probably, as a normal person living in a city, you will get to the, let's say, you don't get to the best doctors. You get to, what you get. So it can be a good doctor, a bad doctor.
Also, in Romania, you have Romanian doctors. In Greece, I think you have Greek doctors. But in UK, you have doctors from all over the world,
yeah.
Multicultural.
And things are different. So it really, really depends on the experience. But from what we experienced, we felt like the best doctors were in Romania, not in the UK.
I mean, it's very random.
Yeah,
you can have at the same hospital for the same problem, the same doctor, and give you mixed feelings about it. You can have great experience, you can have worse experience, you can have good doctors, bad doctors. It's really very random.
For me, I would say they are a bit better in Romania purely because the way they treat the situation. They are more looking towards prevention.
Yeah,
and prevention is not a thing in UK at all.
This is a big deal. So in Romania, it's prevention. It's a very big deal. In UK, only treatment. It's a very big deal. There is no prevention, or such a small part is prevention.
Yeah, things look completely different. I think in UK everything is more automized. Everything is digital. Everything is made to work easier. The structure is great. The system is flawless. Everything is much easier for you as a patient. You don't have to carry your paperwork or everything like that. So in Romania,
you will have to carry a lot of paperwork to go to doctors to explain.
I think it's the same in Greece.
In Greece it's very similar to Romania.
Yeah.
We didn't experience that much in Greece, but from what you told us, it's very similar.
Yeah, from what I experienced too. I mean, in Romania, as in Greece, as it happened in Greece, whenever you get the prescription for the doctor, you have a paper in your hand and you go to the pharmacy yourself with the paper. In the UK, everything happens like so fast and quick. You are in the doctor's office, they ask you where do you want to pick up the medicine from. They would send it to that pharmacy, the order with the medication, and you just go and collect it. That's it.
Yeah, and you don't need paperwork. There, if you go to hospital, you will need your passport or your ID. Also, medicine.
Yeah, when you buy medicine in the UK, there is a fixed price. It doesn't matter what you need. It's per item and it's about £10
in
per
UK,
item.
Yes, around £10.
And you pay for all of them. So you don't get this for free unless you are some sort of exempt from paying. There are some situations when you're exempt from paying.
If you get benefits
other than that, you pay for them. And in Romania, it really depends. We have some for free. We have some that you need to pay only a part of it. and the prices go from 0 to, I don't know, 100 euros.
But also, if you need some under-the-counter, over-the-counter medicine like antibiotics.
Without prescription, you mean?
Without prescription, yeah, without going to the doctor, like, because this is a practice in Romania to, if something hurts you, you get.
You don't go to the doctor. You go to the pharmacy, and you know best what's best for you.
You get antibiotics. So in Romania, you can do that, even though they try to make it so you don't have access to it.
Yeah.
But
you can still do it.
You can still do it. Here you can still do it because people told us you can still do it over the counter. In UK, there is no way you can do it. You can't
even buy a needle.
No.
I tried once. I needed for something, and they said, "What? A needle for what? You have a prescription?" And I was like, "I just want to poke a pimple. What do I need a prescription for?"
Also,
it's crazy.
In UK, they will treat everything firsthand with paracetamol. Everything.
Yeah. This is a joke between Romanians living in the UK. We would always say, "Okay, did you get a paracetamol?" Because whatever happens, they would say, "Okay, did you try paracetamol?" And this is, as you enter the door, you have to say, "I already tried paracetamol. I already tried this.
But have you tried paracetamol with codeine?
The next one, yeah. Anyway.
If you need something more advanced in UK, you will need to go to GP. GP, which is general practitioner. In our country is family doctor. I don't know how it's here.
It's the same.
He's the doctor that will take care of your problems when you have something.
Yeah.
And they will guide you. So if you need something, you need to go to that, and you need to tell them the whole situation. And if they consider, they will give you an antibiotics. But you cannot go and buy them or even have access to them, because you have access to just a few pills and a few medicine in the store, and the other part of the medicine are way behind the counter.
Yeah, I think
look at this villa, Amalia. What do you say about this villa?
I was about to say something, but yeah, this villa is flawless.
Flawless is the only one on this peninsula, let's say. Looks very interesting. Yeah. And how about that one? What do you think is that one?
That one, I think it's where they store the fuel.
Yeah, not that one is, but what is this ship? You think they are bringing something with it?
Yeah, I think this is how they bring it. Anyway, guys, please, if you have a minute, just write a comment. We would love to hear your advice, your experience, and how is healthcare in your country.
Yeah.
I mean, we know 50% of you are here from Greece, so we would love to hear a few stories about Greek healthcare. But if you're from elsewhere, please share a few experiences, or at least the general idea. How do you find healthcare in your country?
Yeah, let us know. Please put some and these comments will really help us. It really helps to support our channel. Really helps us so we can make more videos like this.
Yeah, so whenever you can, just give us a like, a comment. If you don't feel like writing much, just put a thumbs up, just put a smiley face, whatever.
Every comment.
It will help.
Every comment counts.
Yeah,
but
thank you.
And if you are from US, Canada, Australia, please tell us some stories on how it's your healthcare in your country.
Yeah. How do you find it?
Because we don't know much about that. We know that America is very expensive and it's very
we heard some stories, Yeah, back to the medicine. I wanted to say something. Another difference is that usually the GP in Romania and in Greece is a doctor, but in the UK it can be a paramedic, it can be a nurse. So it's not always that you are seeing a doctor when you're describing your, when you have an appointment initially to sort out your issues. Yeah.
Also, to schedule a meeting in Romania, an appointment. In Romania, you will call them. They will tell you an hour or a day. You can schedule on next week, and you go there, but you're not sure if
you have to wait anyway.
If it will be at that time, or you will have to wait another hour.
I would say it's usually like 2 hours waiting, regardless of your appointment.
Yeah, but in UK, you can call only at 8 a.m. in the morning.
And you can only get appointments for that day. So you have to imagine at 8 a.m. everybody's calling, the line is busy, you can't even get in the line. And you have to keep calling until you get a spot in the line, in the waiting. And then by I don't know, half an hour later, all the appointments are gone. So you have to call when it's 8 a.m. period. You have to call and insist until you get the appointment.
Yeah,
You
but
can't get an appointment for the next week.
If you get an appointment, then you will go there and everything is very well organized.
And you will be seen at the time it was scheduled, at exactly that time.
Yeah, it's easy to see your name on the wall. The infrastructure is really good.
Yeah.
Very well organized.
Yeah, and you feel, you know, like in a secured environment, everything looks spotless, flawless. It's you know, it's nice. It's developed. It's a good point.
Ambulance.
Ambulance, yeah.
We can say in Romania you can call ambulance for most of the reasons. If you have pain.
Let's say what we usually do. We would call the ambulance in Romania when we are in the situation that we can't get to the hospital.
Yes.
So let's say you are feeling that bad that you can't get yourself in a car or in a bus or in a taxi and you can't reach the emergency room. So this is the point when we would call the ambulance. They would come and they would either give you some medicine or something on the spot if they can't do anything else for you, or if they feel like it's something more serious and you need investigations, they would take you to the hospital. In the UK though, we have a few experiences with the ambulance, and if it's not a death situation and you call the ambulance,
and they will make a trial to see what's your condition, if you puke blood with dark color.
They try to establish to see how bad it is, how serious it is. So if you should only call the ambulance if you feel like your life is in danger.
Yeah.
Period. You shouldn't call for any other reason at all. Because it happened to us before, and they came and they made such a big fuss. And I understood, but we didn't know how the system works. And one time...
Right? Because if you put it like that, nobody understands. We called ambulance in UK for reasons that they didn't consider it were so...
They were
that...
serious.
And they make a big deal out of them. Like, you will gonna pay this because we came here, we could have saved lives.
Yeah, we didn't know. So basically when we called the ambulance, they sent us an ambulance. We told the symptoms over the phone, they sent us an ambulance. And then when the ambulance came, the people there, they were really, really upset because they considered that the situation was not that bad. We didn't need an ambulance. So
anyhow,
I understand the point of view. We just didn't know how things work, and we don't know. We are not doctors. We don't know if our symptoms are threatening our lives or not. If I feel like I have a pain that I haven't felt before, for me it's the end of my life. I don't know how to compare it, you know. So yeah.
Anyhow, in Romania, in UK, if you have a car and somebody can take you to hospital, doesn't really matter how bad you are, then they will tell you go to emergency.
And it's about 4 or 5 hours waiting time for the list.
Yeah, the emergency waiting, let's say in Greece, was only 2 hours. Was quite fast.
It was quite straightforward here in Hania, and then they sent me to Heraklion, where I had to wait a little bit more. It depends, I think.
Anyway, we have a video about that, how we went
to the emergency
room, with Amalia's problem. Yeah. If you did not see that one, please check it out. It's in the first videos that we made. We will put that in the description. But so emergency waiting, we can say that in UK will take a lot of time. Will take a few hours. But also in Romania will take a few hours.
Yeah, about 3 hours.
In UK will take 4 hours, maybe more if you're unlucky. In Romania will take the same, probably here, because it depends on the day.
Yeah, another thing I noticed, when you get to the hospital in Romania and here in Greece, they do everything. They do blood tests, they do EKG, they do sometimes even X-ray. It depends, of course, of the reason you're there, but they tend to do more investigations than in the UK, I would say.
Yes.
Initially, at least. Yeah, so there are a few differences. Yeah, we have a few experiences, but I think it's gonna take too long to get into all of them.
Yeah, I have an experience with my lung situation, but it's gonna take another video to explain it, because it was a life-threatening, I consider it a life-threatening
It
situation.
was, yeah.
And they came 5 times. We called
In
ambulance
Romania,
5
I
times.
called the ambulance 5 times, yeah. And only the 5th time they took him to the hospital. He was in the position that he couldn't move, so I couldn't take him to the hospital.
Okay.
And I think overall the staff was not that great. I didn't feel comfortable with it because they were not treating you nice or me, and they scared me with a lot of things. Anyway, long story short, it wasn't a great experience. And also when you went to the hospital, it wasn't great.
I think you can have mixed experiences because we had good experiences with ambulance in Romania. So you can't say because of that bad experience, everything is bad.
Of course, we had good and bad.
Same with the UK doctors. You have good experience, you have not so good experience, but you can't say because of that bad experience, everything is bad.
Yeah, and our perspective over Romanian healthcare changed completely once we moved in the UK, because we went with the thought in our mind that Romania's healthcare is the worst.
And this was one of the points that
why we decided to move. So
don't forget to press that.
Our mind.
Don't forget to press that like button because it really helped us. And to whoever stayed until this point, please put a comment with your country flag, just to see how many people are staying until this
are still
point.
watching. Because we are about 20 minutes now.
Private healthcare.
I wanted to say another thing about Romania, and this is a common thing with Greece. Doctors expect bribery. They do expect you to go in their office with some money. When you were in hospital for a month, I think I paid the doctor somewhere around 100 euros. Because this is how you feel more secure that they will take care of your family member.
It's a mindset in Romania that you have to do it.
Yeah, and they expected it.
Your family told you since you were a kid, you were hearing these stories that I paid a doctor, or if you come from a poor village, you will bring some raki, or you will give something to eat, some cheese, whatever, something to give to doctor, just to feel yourself that you made everything that is possible for that doctor to give you or your family the best treatment.
Yeah. I think now they started to see the people that have money and that don't, and they wouldn't take money from the people that don't have money, or, it depends on the doctor really. But
this is a mindset in Romania.
It's a mindset.
It's the same here because you told us in the comments you need to pay the doctors something so they will take better care of you.
Let us know in the comments. Is it like a really expected things? You should do it everywhere. You should do it with a GP. You should do it only with, I don't know, if you have a surgery, or how are really things working, just so we can get a better idea of how to navigate things here.
If you have any experience with this type of payment, please put it in the comment. And in UK,
on the other hand, this is not a thing at all.
not that is not a thing. They will feel offended by this.
Yeah, they wouldn't take money.
No, if you try to give them money, they will look at you like, what's wrong with you?
I think it's even, they can even lose their jobs.
Yeah. As it should be.
Yeah.
Because you already pay for it.
Yeah. So I think it depends how you look at things. Again, we have a different perspective now that we experienced more healthcare systems. We see things differently now, because we would be complaining in Romania, oh my God, I have to see the specialist and he can only see me in 3 months. And I was like, this is mind-blowing. 3 months is a lot. I can't wait 3 months. In 3 months, I'm feeling very, very bad right now. I can't wait 3 months. Until we got to the UK and I had to wait 2 years.
So UK is very well organized, very good infrastructure, but it's understaffed and overwhelmed.
Yeah.
What that means
Too many people.
Amalia had to see a specialist, had some problems. First with the eyes, and because we couldn't get to a specialist, we had to go to Romania to private to do all the surgery, because we already waited for 6 months and nothing was happening. Then Amalia had another problem.
Yeah, with this eye situation.
The problem child is here. The problem child. The problem part of the relationship. It starts from here, as you can see.
Yeah, I'm the one with the issues.
And then you had problems, other problems.
So first time, with my eyes, I had to wait one year just to wait to get an appointment. So I didn't get an appointment in 1 year. In 1 year, they called me to give me an appointment. So I had to wait again for whatever.
And the second time?
The second time,
you had to wait
the
6 months?
The second big time, because in between I had other stuff going on. But the second big thing was after 6 months of trying to get to a specialist and couldn't figure it out what kind of specialist I need. I finally got to a lead, and they gave me an appointment in 1 year and 11 months, almost 2 years waiting time. And just to give you a perspective of how things work in the UK, or at least what we can do to make our lives easier there, I called the hospital every single day for, I don't know, a month or so. And until somebody felt so bad for me, I was keep telling them, look, I'm in pain every day. I can't be in pain every day for 2 years. I simply can't. And I didn't have enough time to go to Romania to stay for a month there. I was working in the UK. And one guy, he was so nice. He said, look, I will give you my personal phone number. Please call me every day, because if we get a cancellation or something, I will somehow find you an appointment. So please call me. I will help you. We will sort it out. Don't worry. Long story short, he got me an appointment in 2 months. Yeah. So instead of 2 years, I got an appointment in 2 months. For 1 week, but he eventually, So this is how it goes in the UK. You will get help. There are a lot of professionals. You just need to find a way to get there. Yeah, so it's very fast, because, for example, I needed X-ray. X-ray for my lungs. In Romania, to make an X-ray, you wait 3 months. 3 months at least, or maybe you can wait 6 months if you're unlucky. Then I went here to UK with all my paperwork to show them what happened. And at the same day that I went to GP, general practitioner, they did the X-ray. It took only 3 hours, the whole experience, going to 2 different... And it's so easy. They don't have any paperwork or anything like that. They communicate digitally, so they would send to the hospital everything they needed to know. You just went there with the passport, did the X-ray, go home. And they even say, look, if it's nothing, we won't call you. If it's something, we will call you and we will make another appointment. So they didn't even call us back, which means everything was great. So, I just wanted to show them this villa again. Come on, Amalia, what do you say about this one? It's really beautiful. It looks like an olive tree, right? Olive tree with golden leaves? With golden leaves, yeah. It's nice. I like it. I think who lives here has a lot of money. They have great views too. Obviously. It's really beautiful. It's a beautiful location. Yeah. Private? Yeah, but about the private healthcare, so what we did for the most part when we were living in the UK was to go to Romania and use the private healthcare, which is way, way more affordable, because here, I think from the three of even then here, guys, if you can believe that. Yeah, I think it's the cheapest one. You can fly to Romania to solve and the doctors are good. I mean, they, as I said, they look into prevention as well. Anyway. So this is what we did. For the most part, we would go to Romania if it was a quick thing and get it done there and come back to the UK. The UK private healthcare is extremely expensive. To give you a perspective, and very confusing. I needed a treatment, and my treatment in Romania per session was £20, and in the UK, the exact same thing, they quoted me £400. You're so silly, but it was a tragedy for me, because this meant I had to delay this issue until it complicated things a lot, to say the least. Yeah, so just to give you a perspective, things are extremely expensive and we couldn't afford it. So I either had to wait 2 years or whatever months or something, or go back to here Romania. Is not that expensive. Yeah, I think you can still afford, if it's something serious, to go privately and get it done if you need it. Yeah. With the private healthcare, this is how we experienced things. So out of all the healthcare systems, I think there are good parts and bad parts to each of them. I can't say I prefer any of them. No. Because I prefer the ambulance in Romania, definitely, because you can call them for any reason. The waiting time in Romania, but the hospitals from the UK, I prefer you even get a menu. So if you get in the hospital and you're admitted, they give you a menu. You have 10 or 15 dishes to choose from, and they are like at the restaurant. So it's crazy. Yeah, I prefer the hospital in UK because it's more modern and
well developed.
Yeah, they have the best equipment, obviously, from Romania or even Greece, and you can tell. So yeah, it's good to have.
Yeah.
Yeah, so we have a lot of stories with what happened, the other situations we experienced in Greece or in Romania or in the UK, health-wise. So if you want to hear more stories about this topic,
And if you
drop a
like this
comment
format,
and let us know.
if you like this format, raw, unedited, uncut, unfiltered, as you can see, we didn't cut anything, any mistake, any arguing, any debate, nothing. Everything is here. If you like it, put some comments there to make more like this.
Yeah, we really need your feedback to see.
And thank you for watching us. Thank you for your like. If you didn't press it, please press it now. It really helps us. And
see you in the next one. Bye.